community to another episode of Do It Yourself Gut Health. I'm Dr. Narala Jacoby, the SIBO doctor. And over the past few weeks, we've been doing these weekly Facebook Lives to help you sort out some of the issues with your own gut, to give you some strategies to help your not just digestive function, but very much your immune system as well. And every week we bring you either myself or one of my team who can give you lots of great information on nutrition, on how to help yourself. Really, this is what this is about, as you are all staying home and perhaps have a bit more time. I know a lot of you don't have a lot more time. A lot of you are very busy with taking care of your children and working still, so it's all a bit discombobulated for a lot of people. But really the intention behind these weekly Facebook Lives is to answer your questions about SIBO, to give you practical tips on how to help yourself, and to really provide a forum for you to more or less ask your questions. So last week, we actually had Anne Kreiner, who's a naturopath and nutritionist here at the Biome Clinic, talk about immune-boosting foods, particularly the foods that have high vitamin C content and high zinc content, because those products are actually difficult to find these days, aren't they? If you've tried to locate some or purchase some for yourself or your family, it's getting harder and harder to find immune boosting foods. Immune supplements. So hopefully that will change at some point. But so that was last week. The week before, I talked about the foundation of healthy eating and it being really calming your nervous system before you even put the first bite of food in your mouth. We talked about some other immune strategies like green tea gargling, which sounds strange, but is actually a really good antiviral mucosal tonifier. If you want to review that, you can go to the video section on the SIBO Doctor Facebook page, where we have a library of lots of helpful videos. Now, this particular one, I'm going to teach you a home treatment, and I'm a big fan of home treatments. I use them a lot in my practice. I'm a naturopathic physician, and as naturopathic doctors, we are trained to educate the patient about how to take care of their own health. And included in that are wonderful home treatments that are really incredibly effective for yourself, for children. I use them a lot for children. And this particular treatment is called the warming sock treatment. And you may have heard about it, but it's really a wonderful immune booster and decongestant. So it's based on the principle of hydrotherapy, or using water and alternating hot and cold, and your ability of your body to heat a cold material. All of that helps to improve circulation to a particular area and increases removal of waste products, but really increases lymphatic drainage and boosts your immune function. So now, the warming sock treatment is probably one of the easiest, most effective treatments that you can do for your kids and for yourself at the very first sign of a cold or any kind of upper respiratory tract illness. It's also really effective for things like neuropathy, diabetic neuropathy, actually, which is often a condition that affects the feet, so nerve tingling and pain in the extremities. So it's really helpful for that as well. But this intention of talking about it today is really to teach you how to do it, so that you are armed with knowledge at the very first sign of a cold or upper respiratory tract bug. All you need for this, and I'm going to put the instructions here, is a pair of cotton socks, So a pair of cotton socks, these are my cotton socks, and a pair of wool socks. These are wool socks that my sister sent me. And these are very, very long. You don't need long socks like this. But these are wool socks, which are difficult to find in Australia, actually. So you might have to order them online or get them from New Zealand or wherever. But wool socks are important in this because they retain heat even when they're wet. So it's important that you get the right type of materials for this. But it really is as simple as two pairs of socks. So, and this is done at night and it's done overnight. Now, this treatment has many different names. It's also called the magic sock treatment. Kids like that one. It's called the cold wet sock treatment, which is really unappealing. But so the warming sock treatment is the next best thing. So all you need to do is you need to have warm feet to begin with. So if your feet are cold, just warm them up in a basin of warm water or so. Then all you need to do is take your pair of cotton socks and put them in cold water and wring them out. So you don't want them sopping wet. You want them nice and sort of not totally wrung out, but wrung out fairly well. But they have to be cold water. Now you're going to put those socks on your feet. It's going to feel horrible for the first 5 minutes, but then it should not feel so horrible very soon. You then cover them with your wool socks. Then you go to bed. If you have kids, you can do that same thing with your kids. You warm up their feet. If they have hot feet, don't warm them up. If you have hot feet, don't warm them up. Basically just put the cold wet socks on and then cover them with wool socks. It's as simple as that. And then go to bed. Now they might complain or you might feel uncomfortable for about 5 to 10 minutes. But after that, you kind of forget about it. You adjust to this sensation of wet socks on your feet. And in the morning, you should wake up with dry socks and a feeling of much freer nasal passages, much more ability to breathe through your nose. So it's one of those that I give to my patients that are parents a lot of times. And over the 2 decades of being in practice, I must have prescribed it, I don't know how many hundreds of times, but I get nothing but great feedback from it. And especially for kids, it works extremely well for children. And oftentimes that will bring their immune system back on board so that by the next day they feel much, much better. So give it a go. It really is as simple as that. You have the directions right there on your screen. You can pause this video, go back to it if you need to for remembering it, get your ingredients ready so that at the very first sign, you can also be a bit blown away by the efficacy or the effectiveness of this warming sock treatment. Like I said, the principle behind it really is about basically increasing circulation, and that also by the virtue of the circulatory system, when you actually heat up the feet, you increase circulation also to the digestive tract, and you increase circulation to your upper respiratory tract as well, and that has this decongestive effect. It sounds super simple and it sounds like too good to be true, but I recommend try it out and let me know in the comments section as to how it worked for you. Okay, now another thing, so that was the warming sock treatment. That really is as simple as that. Now, however, a caveat to that is if after 10, 20 minutes, your feet are still cold and you can't warm them up and it's feeling really uncomfortable, just take them off. And the idea is that your feet probably were not warm enough to begin this treatment. And sometimes when people are adrenally fatigued and they get lots of cold hands and feet, it can be a little bit challenging initially, but always make sure that you start with really warm feet. So you can put your feet in a basin of warm water before you begin this treatment, and that should eliminate this sensation of that you can't warm your feet up. So that is it. That is the magic of the warming sock treatment. Okay. Alrighty, so somebody's saying the screen is very blurry, which is unfortunate. I'm hoping that, can somebody else chime in and see if they can tell me if they see me very, very well? I put effort into it today. I straightened my hair, so I hope it's not too blurry for you to see that. Anyways, I kid. But I'm hoping you can see it. So people that are watching, please give me a thumbs up or so if you can see me and you can see the directions on the screen. So Susan, just to let you know, the instructions say it's 2 pairs of socks. And as I've mentioned, you have your pair of cotton socks and your pair of wool socks. Okay, a lot of people are saying they can see fine. Excellent. I'm hoping that you can go back and find a frame that works for you. Oh, okay. It's only blurry since the words are so small. How about this? How about I hide my... I think if I hide myself, you can't really hear me anymore. So I must have this in there. I will put the directions also in the comments. So I will just see if I can manage to do that. Actually, let's see if I can. Screen is great. Lots of people are saying screen is great. Wonderful. I'm glad you're out there, people. So that was the warming sock treatment. If you have if you've done it before or you're going to do it, let me know how it works for you in the comment sections later on. You can always revisit these videos. Again, they're in the video library of the SIBO Doctor video section where we have a lot of other tips. Last week we had Ann Kreiner, like I said. We also had a meditation on immunity and gut health. And we will keep coming with these little wonderful home treatments that have been around for a long time and are very effective. I am going to at one of these Facebook Lives, I will also teach you how to do a homemade cough syrup. I think next week we are going to have, we might have Anne back for sprouting instructions. But remember also to put in your comments, what would you like to learn about in terms of gut health? I am an educator. I teach people, practitioners and patients about SIBO and about IBS and about digestive health. So, oh yeah, somebody is saying something else about that. So we have, let me just hide this for a moment here, 1 second. So in this particular SIBO Success Plan, which is really a gut health program that is about 10 to 12 hours long that I have recorded for people to learn about leaky gut, learn about SIBO, learn about low FODMAP diet or the biphasic diet, learn about how the nervous system connects with the gut, all of that. And I teach about home treatments as well, especially the short wrap and enemas and cold shower rinses and breathing exercises. There's so many different things that are really helpful for the gut. And that's all in this course. That's only $49 right now. So this is really our flagship course that we teach patients about how to improve their outcomes with SIBO. Okay. Would homemade cough syrup be good for sore throat? Sore throat, do this treatment. Do the warming sock treatment. It's perfect. And we also have an immune stimulation Facebook Live video in the library. And you can listen to that. There is something about gargling with green tea, which is apparently an excellent antiviral and has reduced incidence of influenza in one research study that looked at Japanese nursing home patients. And it decreased the incidence of influenza by 15 times. So it's a really good way to prevent viral infections going down. So we know COVID, for example, sticks around on the mucous membrane a lot. And so this is a good one to prevent it. Well, we can't for sure say that it's effective for COVID, but it is a coronavirus, which a lot of cold viruses are. So this would be something to consider as a when you go out, for example, and have gone to the shops or have gone to work, and then you come back home, you can just gargle with green tea for about 15, 30 seconds. All right, so we've already had a question here. I started a water fast for immune system building, but my feet and hands are cold. Is this indicative of a burdened adrenal system? You know, I often hear that from patients that have a lot of adrenal overload, and I would say that you may do intermittent fasting that might be a little bit easier on your system at this point. Fasting when somebody is really adrenally fatigued is usually not the greatest idea, but you can see how you feel, because you can always break it if you just feel too exhausted or depleted. And one of the reasons why it's not a good idea to fast when you have adrenal fatigue is because your adrenal glands are responsible also for managing your blood sugar. And if that's already being compromised because of adrenal issues, and you then fast, you tend to have a harder time with fasting. But intermittent fasting, which just means it's sort of a timed event when you're eating, so 8 to 10 hours during the day that you're eating, and then the rest of the time you're fasting. So you're fasting maybe 12 hours or so. That's a really wonderful way to include fasting in your lifestyle. Any green tea for the gargling? Any green tea. And the way I often tell my patients to brew green tea is to get one of these French presses, you know, the glass colander things that has about a capacity of 500 mils, which is about a quart. No, hang on. A quart is a liter, I think. Half a quart. What is that? 16 ounces. Yes. And you put a couple of tablespoons of loose leaf green tea, organic. You can purchase it online also. And you brew that for 5 minutes. Then you transfer that into another container, like a teapot. And then you brew those leaves again, because once you brew them the second time, 5 minutes covered, the antioxidants come out a lot more, the polyphenols in these green tea leaves. And then you mix the two together. And that's a great way to have lots of antioxidants, but keep your caffeine levels down in green tea. All right. Excellent. Any other questions regarding immune system, gut health, SIBO? I'll put these back up for a moment, just for those of you who are joining us just now. We talked about the warming sock treatment being excellent for any upper respiratory tract symptoms. So whether that's sinusitis, sore throats, swollen glands, lots of cold symptoms, things like that, this is a great treatment. And really, it's a wonderful naturopathic treatment. If you've heard about Wim Hof, who does a lot of ice bathing, recommendation for immune function and anti-aging, all of that is really firmly rooted in the traditional naturopathic practices that we also teach our patients, or used to, depending on how naturopathic your naturopathic doctor is. But really, it's about using things at home that you can use to help yourself. All right, this is a bit of out of left field. What do you do if you're? I guess you think about lipopolysaccharides, or your LipA is high, which is one of the issues with high cholesterol and lipids. That's that's a whole nother discussion, not related to gut health and not related to immunity. So this has to do probably if you have sort of a genetic propensity towards high cholesterol, and usually with lipo A and lipo E and all of that. This is a whole nother discussion that I can't just off the cuff give you a recommendation. I'm sorry. All right. I have a fungal infection again, can't get rid of it. I got diagnosed with SIBO in December and really don't know if it's gone. The only way that you know if it's gone is if you retest. And this is something that I tell my patients all the time, not just my patients, but practitioners that are treating SIBO, is don't just assume SIBO is gone, especially if symptoms remain, because very often you will have resolved the SIBO, but if symptoms persist, then it's just another layer to this whole case. So you have to treat what else is there. So the first thing I would say is if you've treated SIBO, you still have symptoms, just make sure that you actually repeat your lactulose breath test so that you understand if it's now gone and you don't have to treat it and you have to treat whatever else is causing your symptoms, which may differ. So this is one of my biggest pet peeves about people just treating SIBO without actually testing, because I have seen a lot of fallout from that in terms of people being referred to me, or I'm seeing them after months and months and months of antimicrobial treatment, which will have affected their microbiome as well. All right. Bella asks, on the SIBO biphasic diet, well done. Are any particular meats offal recommended above others? Not really. Not really. I mean, you know, grass-fed beef liver is something that actually Anne discussed. We discussed it last Facebook Live. So I don't usually am partial to any organ meats unless they're from organic animals, or organically raised animals. I would not use beef liver or kidneys or any of those kinds of organs from animals that have not been raised in a really clean environment, is the only caveat to that. My husband with SIBO has mold toxicity shown on Great Plains urine test. I'm assuming the mycotoxin profile. My 6-year-old son also has SIBO, and I'm wondering if I should test him for mold too. He was only in the moldy house for 3 weeks, though. Is that long enough for my son to get mold sick? It often depends, right? I mean, how long is a piece of string? Meaning that some people get sick really quickly and some people it takes a while. But let me just back up a bit. The reason why mold toxicity is so important when you have chronic SIBO is because when you have a moldy environment in terms of a water damaged building or a work environment, or you just have mold that's growing in your house because of other reasons, because of moisture, air moisture, that mold can secrete toxins called mycotoxins. And mycotoxins do several toxic things to your gut. And one of them is called being toxic to the myenteric plexus. And the myenteric plexus is kind of like your little central nervous system in your gut. So if you have toxicity there, then your migrating motor complex and your motility can be affected, and everything kind of goes haywire. So mold is really very much people that have SIBO. And I had a great podcast with Dr. Jill Krista, who wrote Break the Mold. And if you want to go to the SIBOdoctor.com and click on podcasts, you can listen to that podcast, which was really excellent. And the book is excellent. So to answer your question, I would definitely try to get on top of the mold before you go down the road of continued SIBO treatment. So that's what I had to do. A lot of people that were very sick continued to have SIBO relapses. And like, what's going on? You don't fit the criteria for a lot of these other things. What's happening? I then had them do assessment for mold, or did the mycotoxin lab through Great Plains, and they were just loaded with mycotoxins. So in that case, you really want to address the mold exposure first before, and then you have a lot more success with keeping SIBO at bay. Good luck. And as far as your son goes, he might just have symptoms of the mold exposure. It may not be SIBO. It may be something else. All right. Let's see here. Susan asks, when a client is on restricted SIBO diet and suffering from constipation, apart from using something like magnesium, what foods can you suggest? Great question, Susan. So one thing you can try is just to use the vegetarian biphasic diet, which you can get from the SIBOdoctor.com, free download. It's one of the 3 versions of the biphasic diet that I created, and that tends to do a little bit better. It's a lot more sprouting and different grains and legumes. Usually, if there is a high methane component, then I use things like partially hydrolyzed guar gum, and I use very specific probiotics. And if you're a practitioner, you might want to look into the SIBO Mastery program, in which I completely lay it all out in terms of what strains of probiotics, what to use when, what to do for constipation, because it's a big problem for people. So, but it's a great question. So there's lots of different variety. But for those, I usually do try to get some PHGG or partially hydrolyzed guar gum in there as well. How do you get rid of psoriasis? Okay, well, psoriasis I find is more related to endotoxemia in the large intestine very often. I find eczema typically a little bit more related to SIBO because of its leaky gut component. But with psoriasis, we see a lot of endotoxemia and a lot of skin issues due to the toxic absorption of toxic elements that are from dysbiotic bacteria in the large intestine. So typically with psoriatic patients, I work with the liver, I work with the large intestine, and they don't tend to have as many food allergies, I find, as people with eczema. Constipation got much, much worse after taking the rifaximin for SIBO that my doc put me on. What do you recommend? Well, it sounds like, rifaximin is an antibiotic that is very, very active in the small intestine. Your small intestine still requires a good microbiome. And if you've been on rifaximin and symptoms got worse, it's sometimes the case that it wiped out your remaining good, or maybe not the remaining, but a lot of your good bacteria in your small intestine. And maybe yeast overgrew in its place, which is super, super common. It's called SIBO. And that's why we usually recommend using an antifungal alongside rifaximin so that you don't have this type of problem. But I would recommend that you work with a practitioner that understands strain specificity of probiotics. That might be, you can go to the SIBOdoctor.com and go to the practitioner database. They've all been trained through the SIBO doctor education, which really goes into what to consider in those cases. But like I said, you may now have some yeast overgrowth, and that often is contributing to constipation. And a good probiotic, for example, that's also associated with motility is Bifidobacterium lactis, HN019, a very specific research strain that has been shown to improve motility. So that may be a good option for you, but I'm just throwing out one particular product. I'm not somebody that believes that products will save all of our, or how should I say this? I'm a firm believer in a multi-approach to a condition rather than a cookbook approach. This is what you do. Every person has a different story and a different reason why they're sick. Yes, there are protocols that I teach as well, but you always have to consider what else is going on, of course. And so I don't think there is one product that is great for everything. All right, moving on. What are your thoughts on those portable saunas for recovering from mycotoxin illness? So, great question, Lynn. I think they're pretty good. So what Lynn is talking about are these little foldable things where your head sticks out, kind of like a Russian sauna. I have finally fulfilled one of my lifelong dreams. I'm almost 53, and I finally got my sauna last year, but I am like the real deal, the Swedish sauna, the pouring the water on the rocks and then showering cold and then jumping into a cold plunge bath. That is how I grew up. I grew up in Germany, and we like those kinds of contrast, cold and hot. So that is what I like, and I find that to be the most effective to increase circulation. But the whole idea behind far infrared saunas or fur saunas is that it's a different spectrum of heat, and it's not so overwhelming. Like my sauna, I have to get out when it gets 80 degrees Celsius, which is about 130 something. But in far infrared sauna, it actually penetrates deeper, but it's not so hot, and it bypasses, the claim to fame is that to some extent it bypasses the liver and you're sweating out a lot. I find that to be the case with any sauna. Any sweating is really good. I mean, sauna and is better than exercise-induced sweating for the purpose of detoxification. So to answer your question, a lot of people that I know have one of those portable ones, and as long as you sweat profusely, it's doing the job. So that is the answer to that, I think. And then just make sure that the way I teach people how to do sauna, again, this is also in the SIBO Success Plan, which is my educational course on gut health. That is really extensive, and you get access to the dispensary guide where I recommend very particular products. I don't sell products, I use them in my practice, and you can find them yourself, but there's a guide of how to do that. Anyway, so I teach about proper sauna technique, and the proper technique is basically you're in the Swedish sauna, but also in the far infrared sauna. You want to work up a really good sweat and your heart rate up a little bit. That means a lot of blood has come to the surface, and your heart has to beat faster because there's less blood going around because it's all at the surface. And you really want to be like to the point where, oh my God, I got to get out. And then you take a cold shower for about 30 seconds. And if you have a cold plunge, you jump in there like a bathtub or so. And then you rest with your legs up for 5 minutes. And then you repeat 3 times. So that's the way I do the sauna. And make sure that you replete your electrolytes and all of that. Okay, Linda asks, just finishing GI Microbex, oil of oregano, and Primal Earth soil-based probiotics. How long do you stay on the soil-based probiotics? I get this a lot, this question about soil-based probiotics, and the answer is I haven't seen a huge amount of research about soil-based probiotics causing or improving, or just in terms of research, I haven't seen a lot. There's a really popular brand, the Megaspore, and the research looks promising, but a lot of that is in-house, meaning that the company did the research. I use Megaspore occasionally for patients, not across the board. And so the question is, you need to ask your practitioner. I know a lot of people don't have practitioners. I cannot give you medical advice. So because of, obviously, this is a public forum where I can't really give you specific advice. But if you don't have any adverse, here's another thought, is that soil-based probiotics just pass through you. They don't colonize, they don't stick around. So if you don't have any adverse effects, and if you're getting better, this might be helpful for you. But if you're not feeling much better, then you might want to look at other types of probiotics or therapies. All right, let's see, a couple more questions. We have Corbina who asks, I have a great appetite towards fats, butter, nut butters, particularly always want to eat. Not before I had SIBO. I eat a lot also, again, much more than before SIBO. Last test had very low SIBO, but high score in large intestine. Okay, so sometimes appetite can be high if you have leaky gut, because in a situation of leaky gut, what happens is you're actually absorbing a lot of partially digested foods, but you're actually not absorbing micronutrients very well. So firstly, I would optimize digestion with you and probably look at a possibility of leaky gut. Now, of course, appetite also can have to do with the two, like, or a dysfunctional system where you have there's a hunger hormone called ghrelin, and then there is another hormone that is more involved with satiety called leptin, and so you might have some issue around it gets complicated as to why that happens, but I would, there's such a leaky gut is so common in SIBO that would be my first thought, is that you probably you might be nutritionally depleted on some level. So, all right, hope I answered that. High methane, okay, Lucinda, high methane and hydrogen by breath test. Yes, so that is probably the cause of your constipation, is that high methane. So you got to keep going and keep testing to see if your therapies are working. All right, folks. This has been another episode of the Do-It-Yourself Gut Health. It wasn't specific for gut, but it is great for gut as well in terms of anything that increases circulation. And like, again, every Thursday, we tune in and join us for these Do-It-Yourself Gut Health sessions. We have a lot more coming as this lockdown continues. And please leave your comments or your recommendations or your questions. Questions are best answered in the forum or in here. We do have if you're a practitioner, you can join us in the practitioner or the SIBO Doctor Practitioner Forum. And if you're a patient, you can join us in SIBO Lifestyle, where we post a lot of tips and things like that. All right. I hope everybody is not going too stir crazy. I find myself I'm actually pretty busy, so I am still waiting for that blissful boredom that some people are talking about. I don't experience that. I have a lot of things to do, and I hope you two are staying safe out there and are finding inspiration by this incredible outpouring of creativity on the social media platforms. A lot of people are doing what I'm doing to share their knowledge and to help people take charge of their health. So I hope you do the same, and I wish you all the best, and we will see you next Thursday. Take care.